Welcome to Local Edition. I'm Bella Shaw. By the age of 50, 85% of the population will show some signs of disc degeneration. What does that mean, and what steps can be taken to help correct this problem? Dr. Mark Leiker is here, the staff neurosurgeon at Henry Mayo Hospital. You're actually part of a national training program to help doctors such as yourself learn about this new technique. And I see you brought a little model here. What are we talking about when we talk about disc replacement?
Well, in the past, when discs go bad because of wear and tear, because of genetics, smoking as well makes the discs go bad, patients have pain, and that pain can be neck pain, back pain, arm pain, leg pain, and I'm sure everyone knows patients who've had that, knows people who've had those type of problems.
Sure.
And in the past, there were a number of different ways to treat that surgically. And most of those techniques involved a fusion, which means instead of having a nice disc that allows you to move and bend and twist, you're fixing together two bones of the spine, and that prevents movement. It takes care of the pain in many instances, but it prevents movement. So that creates a whole set of other problems that we have to deal with. So a number of engineers and doctors came up with a concept of, instead of removing the disc and fusing it, replacing the disc with something that replicates its movement, replicates normal movement, and that allows the patient to go back to normal activities.
Could you demonstrate what you're talking about here?
Sure. Now this is, what I have here is a disc replacement for the neck, for the spine in the neck, and it involves a ball and trough concept. Instead of a ball and socket like a hip joint, this is a ball and trough where you have a variable center of rotation, meaning instead of a rotation around a pivot point, you actually can translate the neck forward and back, which is the normal activity of the neck. The bones in the neck can actually, in a normal neck, can translate back and forth, forward and back, when you're bending your head forward or back. And so this replicates the normal activity of the disc in the neck. The technology was in development in Europe, actually, for many, many years. Finally came to the United States after 5 or 6 generations of the technology. And we went through a large clinical study involving many, many patients, over 500 patients. And the studies have been really phenomenal for surgeons who do this kind of surgery.
And so a disc, you use a disc instead of the fusion technique. Is that basically
Correct.
Breaking it down into real simplified terms here?
Right. We call it a disc replacement. It's not a real disc, obviously. It's not a human disc.
Right.
It's not an animal disc. Obviously, we use animal parts in humans for different things. It's a synthetic disc. It's made out of stainless steel. And all it really does is allow the normal movement of the spine bones between the two segments that you put these between.
Now, what about post-operatively? Do the patients have to wear a neck brace for a period of time?
Yeah, that's one of the biggest complaints that I get when I do a fusion, and we still do a lot of fusions. Patients don't like the neck braces. It's important to wear a neck brace because in order for the fusion to grow, you need to make sure that the bones are immobilized as much as possible. The nice thing about this technology is you want the patient to move. You want them to regain the normal movement, normal activity of their neck. And so after the surgery, I may keep the patient in a brace for a week or so, only so that they don't strain their neck muscles. During the surgery, we have to cut through some of the neck muscles to get to the spine. So once those are healed, though, the brace comes off and they can move normally. It's
a very delicate procedure, isn't it, when you start dealing with the spine?
Sure. We're operating around nerve roots. We're operating around the spinal cord, around the carotid artery. Very important entities in the body.
So how long does the operation take, and what is the recuperative time?
Well, the operation, one of the nice things about this procedure is it's very similar to the procedures that we've been doing for decades. It's very similar to a fusion, except instead of putting the equipment in for a fusion, we put in this piece of equipment.
And unfortunately, we are out of time. But I want to thank you, Dr. Mark Leiker, for joining us here on Local Edition. And we thank you as well. We'll see you next time. I'm Bella Shaw.